Today I want to talk about one of the most important elements of any reform, and that is a strong public health insurance option. Frankly, I'm disappointed that this has become the topic of so much controversy because it really is such a fundamental part of making sure we provide the reform that my constituents and all Americans deserve. Some have even suggested scrapping a public option in the interest of passing a bill with bipartisan support. Well, Madam President, I want to pass health care reform, and I hope very much we can do it with bipartisan support, but I'm not that interested in passing health care reform in name only. I'm not interested in a bill that allows us to somehow tell our constituents that we've done something but doesn't really address their concerns that they've had so very long. We need real reform, and real reform means a strong public option. And Americans want a public health insurance option. According to a recent poll by NBC and the Wall Street Journal, over 3/4 of those polled said they would like the ability to choose between public and private health insurance plans. Providing a public health insurance option does not discriminate against those with pre-existing conditions and illnesses, and it will significantly improve the ability of people to access health care. There are millions of Americans who tell you that the current so-called competitive market didn't work so well for them because they were denied coverage from the outset, or they were given a benefit plan that covers everything but the diseases that they actually have. Health insurance should not be a privilege, but in today's insurance market, that's actually what it is. Those who are healthy enough to be approved for coverage or wealthy enough to afford it are too often the privileged ones who receive health care. We must shift the competition back to where it should be, on the health insurers competing to provide better coverage at a more affordable rate. A public health insurance option, if done right, Madam President, will help shift the insurance market so that plans focused on what is best for the patient thrive instead of plans simply focused on the bottom line. Just a few weeks ago, Jerry Weitzel from Durand, Wisconsin, shared her story with me. Jerry's husband suffers from renal failure. His medicine and care cost hundreds of dollars each month, and the family has thousands in medical debt. Jerry is doing her best to make ends meet for her family, but sometimes has to choose between paying the monthly mortgage on their home or her husband's medical care, without which he will die. Jerry told me that she came to Washington, D.C. to share her story because her husband is, quote, choosing death over debt. She worries that they will lose their home, and they've already lost their savings. But above all, she worries that she will lose her husband. With a strong public health insurance option, we can ensure that Jerry and her husband can afford policies that cover their medical bills and can focus instead on getting well. A strong public health insurance option is one the public can depend on to be available regardless of pre-existing conditions and place of residence, income, age, sex, health status, or job status. It's an insurance option that will be focused on helping the sick get the treatment they need instead of just turning the biggest profit for shareholders. It's also an insurance option that will help the public invest in wellness and disease prevention and primary care and chronic disease management. A public option will help ensure that no matter what, people have access to a health insurance plan that actually meets their needs. Now, Madam President, one of my priorities in the health care reform debate, and one of my priorities throughout my time in the whole Senate, has been fiscal responsibility. It's not enough to pass a bill that expands coverage. We need to do so in a way that reins in runaway health care spending and ensures that taxpayer dollars are not wasted. And that's another reason, Madam President, why we need a strong public health insurance option, because it will help keep costs down for individuals, for employers, and for the government. Citizen Action Wisconsin estimates that a strong public health insurance option operating in a health exchange could save Wisconsin employers, both private and government, over $1.1 billion each year. For the average Wisconsin family, currently paying around $13,500 a year in health care premiums, this translates to a 33% savings, lowering their premiums to just over $9,000 a year. Now, this is real savings, and it would have made a big difference to Deneen Spencer of Rhinelander, Wisconsin. Deneen has had a tough 4 years, recovering from multiple conditions which doctors expected to leave her a quadriplegic for life. Deneen credits the medical professionals at Froedtert Hospital in Milwaukee with helping her reclaim her mobility, in many ways, her life. But while Deneen has already made incredible progress, she still has a long way to go. Fortunately, Deneen qualified for disability and Medicaid benefits to cover her medical costs, but she wants to be independent. She wrote me a letter in which she says she, quote, wants to get off disability very, very badly. I'm horribly ashamed that I collect a government check every month, but as it stands, I simply cannot afford private health insurance. Deneen writes that she has heard a public option health insurance plan would sharply lower costs for people like me, she said. Please put everything you have into making sure it is part of the health care reform bill. Deneen has already overcome incredible challenges. She wants to purchase health insurance, but is denied that benefit by the existing system. So, Madam President, a public health insurance option would help ensure that Deneen is guaranteed affordable, high-quality health care. Too often, Americans are at the mercy of the insurance companies when it comes to paying premiums and out-of-pocket costs and deductibles. While I commend the growing efforts of select insurers to increase transparency, for the most part, consumers have little idea how much procedures cost, where premium dollars go, and whether you're truly getting the best value for your dollar. A public health insurance option would serve as a benchmark competitor for premiums, for administrative costs, and benefits packages. A strong public health insurance option is consistent with a healthy private market and effective private insurance plans. We have several insurers that operate in my home state of Wisconsin that provide great health coverage to their beneficiaries. Responsible insurers should have no trouble competing with a public insurance option on the merits of their plans, but a strong public health insurance option will provide a powerful incentive for less responsible insurers to reevaluate their own cost-sharing and benefit plans to ensure that they are actually an attractive option for consumers. And there's another benefit of a public health insurance option which hits particularly close to home. My hometown of Janesville, Wisconsin, has one of the highest unemployment rates in the state. Recently, our GM assembly plant ceased production, and other related businesses throughout the community are struggling to stay afloat during these tough economic times. And of course, these challenges are shared by many other communities across the state of Wisconsin. Madam President, a public health insurance option would be invaluable to families in Janesville and other parts of the state who have recently been laid off, because it is a guaranteed, affordable option that can travel with an individual from job to job. A public health insurance option would also make a tremendous difference to our small business owners who face crippling health care costs while trying to keep their business open. So, Madam President, health care reform cannot wait. The President has said that he wants a health reform bill on his desk by this fall, and I will work hard with my colleagues to make sure we send him a good bill that guarantees every American high-quality, affordable health insurance, and that includes a strong public health insurance option. After so many years of delay and inaction, now is the time to act. Madam President, I yield the floor.